Welcome back. We're looking at how globalization has affected the multi-billion-dollar healthcare industry around the world. Here in Washington, D.C. is Joseph Woodman, the president of the Healthy Travel Media Company and author of Patients Beyond Borders. From Rutgers University, I'm joined by Dr. Wise Young, a world-renowned neuroscientist. And on the phone from Mumbai, India, I'm joined by Vishal Bali, CEO of the Wockhardt Hospitals, which provides treatments for medical travelers. Let's get back to our discussion actually with Vishal Bali in India. An email that came in, if I may put this to you. It came in from Australia, from S. Anoma in Sydney, who wrote in saying, it was common for the wealthy to seek specialist care in prestigious hospitals in the UK and US. Now American and British citizens seek medical treatment in developing countries as they can't afford the same treatment at home. In India, has this meant that there are fewer resources for the poor in the public health system? I guess the question, Vishal, is it becoming an us and them system of healthcare in India?
I don't think so, Riz. I think what's important is that at any given point in India, hospitals like Wockhardt and the others would serve 90% of the Indian population. And the remaining 10% would come from the rest of the world. So I don't think that, this is an issue in terms of that when you connect with the globe and when you're living in a flat world like this, the trends which are truly global trends cannot be isolated to just one part of the world. And so therefore it is important for countries like India to engage in a larger global impact that healthcare is making, while at the same time we are ensuring that our populations in this country get better and better quality of care. Okay. So there are more and more hospitals which are coming up in the smaller cities around the country. There are more and more hospitals which are going into the Tier 2 and the Tier 3 cities, while at the same time there are hospitals in this country which are now attracting patients from the rest of the world. So I don't think that we are in a dichotomy kind of a situation over here. But I think both these trends are moving simultaneously in India.
Okay. I want to ask you, Joseph Woodman, about, in your research and traveling through these countries and checking all these facilities, do you know of any developing country that forces the income from medical tourism to be pushed at least partially into the care of the poor, some kind of redistribution and some kind of investment in the infrastructure at home?
Well, I can make the general statement that the quality of care, the benchmarks, the transparency, the continuity of care, and the quality assurance that enters into a country when you've got a select number of hospitals participating in global health care and medical travel helps to raise the standards of that country in general. It doesn't solve all the problems, but it does help to raise the standards. In India, I do know that another hospital network, Apollo Hospital Networks, has some formal programs to run the profits from their hospital into clinics and other facilities and telemedicine in the rural areas. Yeah.
Dr. Young, what sort of laws in the West might inhibit medical tourism? I mean, are there, because there are quite a lot of issues, obviously, when it comes to litigation, insurance, and so on. What would inhibit medical tourism really picking up here?
Well, first, I want to say that I agree very much with the previous comment that the quality, the standard of care has risen tremendously, and it does increase the standard of care in the third world countries, and India's care has risen remarkably. I think one of the biggest problems is really there are certain procedures that are done differently, and the criteria are different, and the standards of care may be different in some countries versus others, and this is where people have to be very careful, because there's no recourse if something really goes wrong. And I think that there's one other issue that I've been talking about, because I think the other two guests have been really talking about more standard things like hip replacements and so on forth. There's the area of experimental therapies, and this is the place where I think people need to be the most cautious, because the standards for allowing certain types of experimental therapies to be carried out are very different in these countries versus the United States.
Actually, Vishal Bali, that's an interesting issue. Dr. Young raises experimental therapies, but there's also the issue of cosmetic therapy and cosmetic medicine as opposed to just regular medical procedures that are needed. And to what extent are you seeing in India there's a huge demand or an increase in demand for cosmetic surgery?
Yes, cosmetic surgery, or soft medicine as one can call it, when this entire trend of medical tourism started, it basically started with soft medicine. So, there were whole bunches of people who were basically looking at tourism, but they were looking at these soft procedures because they require lesser hospitalization. They can be done while somebody is there on a holiday trip. So these were some of the procedures which sort of became very popular in the initial phase of medical tourism. But more and more what we are seeing now is that it is not just for these kinds of procedures, and even these procedures, because of accreditation standards and because of regulations which have sort of come in terms of ensuring that good quality of care is given to patients, these procedures have sort of now gone on the backstage, and more procedures are being done which are on the serious medicine side, which are basically life-saving and life-enhancing procedures like cardiac surgery, joint replacements, hip resurfacing, and a couple of other spine surgeries.
We had an email I'd like to put to you, please, Joseph. It came in from Bosnia and Herzegovina, from Amra Hodzic, who says, medical tourism is well known in Bosnia and Herzegovina. Our diaspora, during their summer stays in Bosnia, visit dentists and even do plastic surgeries, as medical services are much cheaper in Bosnia than in countries in which they live. If a patient can get the same treatment for less money, it's worth traveling. Now, I wonder to what extent you're seeing that as well, that people, are drawn to their own countries, and if they find, if they're diaspora going back for vacations, they're drawn to the medicine in their own countries if that facility is available.
Well, it's natural to do that because of the cultural familiarity, the language familiarity. So if it's not your own country, it's much more common for folks to travel to their own region.
In fact, it's interesting, you and I before the show were talking about sensitivities and cultural sensitivities, and you were saying there are areas where, for example, travelers from the Middle East have their own sort of areas, wards, because they might be more culturally sensitive. Women may be covered, for example. You're finding more catering for that kind of client.
Oh, absolutely. Bumrungrad Hospital, for example, in Thailand, which is arguably the largest international hospital on the planet. They serve something like 200,000 or 300,000 individual patients every year. They have an entire ward for an entire wing for the Arabic populations, where they have interpreters for the different, not only Arabic, but the different kinds of Arabic. They have cuisine that is Arabic, and they have worship. So yes, putting folks at comfort is a huge part of the medical travel experience, because folks know that they're traveling long ways, and they're a part of their procedure and a part of their recovery is in good. The success of that recovery is in good part related to the comfort level, and no one beats the Thais for hospitality.
Well, Dr. Yen, one of the things I learned in my early years doing medical physiology is that the hardest thing is diagnosis, and I wonder what sort of problems are presented by cultural barriers, language barriers, sensitivity to revealing information and so on when it comes to medical tourism. People traveling may not be so inclined to give away so much information, but they may also have language barriers and understanding issues.
Right. Diagnosis is a very serious problem, because many people do have very complex diagnoses that need a lot of tests, and they frequently don't bring all their medical records with them. I deal with spinal cord injury, for example, and there are people, for example, who've gone to places for spinal surgery and stem cell transplants, and they would go with a severe neuropathic pain syndrome, and the pain syndrome might get worse or whatever during the post-operative period, and in such cases they try their very best to take care of these problems, but it's a very difficult situation when somebody doesn't speak the language as well. I think that the most important thing that we have to understand is that many of these places are not quite yet at U.S. medical standards, and people who go to these places are often disappointed by the cleanliness of the environment, by the way that they're being treated, the lack of nursing care, and so on and forth. So people should investigate very carefully before they go, and they need to talk to other people who have been there. And finally, I think there's a philosophical question that we do need to talk about, and that is, it is really unfortunate when a given country, for example, UK, or in many cases people in the United States, actually have to travel overseas to get their medical care. Right. That means the country itself is not providing it for them.
Vishal, just 30 seconds to go. You know, when I was in India, I have to confess, I, just through a recommendation of a friend, went for a complete checkup and was impressed with the doctors. But I found out by accident. How are you promoting, just literally in 15 seconds, how are you promoting the idea of what you've got out there?
I think, Riz, more and more it's being done by patients themselves. So, you know, patients who have come here are talking very good about their experiences here in India and about the kind of services they are receiving. Secondly, I think what's also happened is that India's image around the world has changed tremendously over the last couple of years.
Well, Vishal?
And that is adding to the shine.
I have to stop you there, I'm sorry, but Dr. Young, Vishal Bali and Joseph Woodman, great to have you with us.
Thank you for having me.
Thank you, gentlemen. Join us for our next show looking at Iran and US security. Recent focus has been on nuclear ambitions, but George Bush's former National Security Council director says it's one of the leading sponsors of terrorism in the world. Find out why. Join us next time.